A pterygium is a fleshy mass or growth that we notice over the medial aspect of our eye or the temporal aspect of our eye. It's a fibrovascular layer that can happen naturally. Now, some cultural backgrounds are more prone to this. Living in a climate that has an increased UV index, like Calgary, which is the sunniest city in Canada, or a drier climate like Calgary, are both risk factors for getting this. So usually you see a growth over the surface of the eye that can happen in the medial aspect or the temporal aspect. The goal is to prevent this pterygium from growing across into the line of sight, and also it can change the shape of the cornea. So it can flatten it and steepen it, so your vision can change from the pterygium. So the goal is to remove it. Now, I went ahead and tried to display my artistic ability by drawing two eyes, a nose, and some pterygium. I wanted to take you through how we do pterygium surgery. So if this were a pterygium, the goal is to remove this tissue. You take a tissue that's similar under the eyelid. That would be called an autograft. And this is transferred over into the area here. And by doing that surgery, we accomplish a few things. We remove the pterygium that you had. We place a graft in place that acts as a bumper for a new pterygium not growing back, and then it looks really nice. If we undergo pterygium surgery with autografting, the chance of that surgery going well is over 99% of the time. The chance of the pterygium growing back is less than 3%. So we're expecting a great outcome. How do we get it? Well, we patch your eye first day. You'll be on some pain medication to make sure that you're comfortable. We'll take the patch off the next day and you'll be like, whoa, it's really red. It will be red because we use glue. We don't use stitches. That glue that keeps the graft in place will last for about 48 to 72 hours. So no rubbing of the eye, no water in the eye. We give you a shield. You wear that shield over your eye for the first week. The blood or redness in your eye will take about 3 to 4 weeks to go away, but it will go away. And after it does, you get this beautiful result. We'll ask you to use artificial tears 4 times a day and a gel in a tapered fashion about 4 times a day. We see you on the first day after surgery, and then we see you again in 2 weeks. If we're going to do multiple lesions, depending on how big they are, we usually do 1 or 2 at the same time, or just 1 at a time. So you might need multiple appointments or multiple surgeries if you have multiple pterygium.